Antibiotics are overprescribed in the world and create a lot of havoc because of the fact that we have bacteria and microbiomes everywhere, in our skin, in our eyes, in our mouth, in our sinuses, in our intestinal tracts, and in women's vaginas, etc. Just getting onto an antibiotic just at the drop of the hat is not the best idea because you throw the balance of your entire microbiome off. There are times when they're necessary. They're often overprescribed when someone has a cough or a cold. There's, of course, need for antibiotics when a cold has progressed into a secondary bacterial infection and you've developed pneumonia. But usually a cough is caused by a virus. Sometimes people are thrown onto antibiotics when it's really not appropriate. Sometimes a woman gets a urinary tract infection, and if she catches it early, drinks a ton of water, takes something like D-mannose and cranberry, etc., but she might be able to kick it without having to hop on antibiotics. But if any of you have had a bladder infection, you know that if it's moved into a full-blown bladder infection, it's almost better to take the antibiotics than not take the antibiotics because it can be so miserable and it can move up into the kidneys and cause a nephritis, which can put you at risk for developing sepsis. So there are times when antibiotics are absolutely necessary, and there are some things you can do to more quickly rebalance yourself after antibiotics. So we all know about probiotics, but it is really helpful. There's a debate, like, do you take probiotics with antibiotics or do you wait till you're done? I've always felt like that debate is kind of unnecessary, and I usually recommend taking some probiotics while on the antibiotics, but then more when you're done. The other thing that can happen is that antibiotics, particularly certain types of antibiotics, can kill some of the bacteria in the gut that keep yeast in check. We all have yeast in our intestinal tracts, and usually it's kept in check by some gram-negative bacteria. And if you're on antibiotics, you kind of kill those off, and then you can allow the yeast to overgrow. And then a person can get gas and bloating and loose stools, etc. So then I would recommend taking some herbs that are helpful for yeast, like oregano. I like this enterically coated oregano called ADP, berberine, grapefruit seed extract, products that have a combination of these things together. Candibactin is one that's good. Hopping onto some herbs post antibiotics can help kill yeast along with the probiotics, and you can often rebalance yourself quickly.